Hi, it's Lori and Dean Kane, and we're with Jenny, who's here to do some improvement for her wrinkles along her forehead, and they've gotten a little deep, and so the plan is to actually do a Daxxify, which is our newest Botox, which we really like a lot. It kicks in fast, it's just as strong as Botox, but then because this is so fairly deep, that we're going to actually use a filler to fill that in. And with that, we're going to use what's called an RHA2, which is a very unique filler that blends well into bony areas.
Well, there's two basic philosophies as to what patients want, and that is no lines of the forehead, which means by taking away all those lines, you've also relaxed all the muscles, so the brows fall to their lowest place.
So wait, I'm going to interject there, so I'll explain what he meant. So when people take Botox and they think, oh, we're just going to Botox those lines across the forehead, and they think that's going to take care of the lines, well, it does. It freezes the forehead,
but the eyebrow falls.
But they drop. And so the goal is to not put Botox across the entire forehead, but to only do your Botox kind of in the glabella and the lateral, which gives you this nice elevation to the brow. However,
that leaves you with some lines up on your forehead. So I've been able to take some very, very thin HA fillers and be able to inject them across the lines almost to the point of erasing those lines. So that way you have your cake and eat it too. You can have your brow and brow lift, as well as a full reduction in all the lines.
What's really great is that the filler lasts a whole year, even longer sometimes in the forehead.
And it promotes for the Botox to stay around longer.
Yep, so it's a win-win situation.
So we're back, and after we've injected the Daxxify to relax the muscles and rebalance those muscles, Jenny's going to show me where the lines are. And we're going to start working along the lines. Go ahead and relax, so that we can fill them. And you can see with a little gentle technique and the right filler, you can't use every filler for every area. As you see on her face, we're going to be doing fillers in the cheek, and those are going to be deep fillers. This is a very superficial filler, and you can see how the lines almost erase themselves.
That's pretty incredible. They just go away. Dr. Dean Kane, being a board-certified plastic surgeon who has done forehead lifts, brow lifts, Botox, and facelifts, he really has a good understanding of the anatomy of where the blood vessels are and the nerves. So again, not everyone can do this procedure for you. So you really do need a very experienced provider like a plastic surgeon to do this procedure. All right, Jenny, you're line free.
Yay!
We'll show you.
I'll show you.
You're all